Good afternoon. Thank you for joining us for our virtual CU Anschutz Wellness Series, Happy and Healthy Hour. I know some of you have joined us for our last few virtual events, and for some of these events in person this past winter. We are so glad that you are back with us again this afternoon. We know this is a difficult time for many members of the CU Anschutz alumni family. We are proud of the expertise and support our alumni bring to their communities and our campus, especially in times like this. My name is Denise Smith. I am an assistant professor in the College of Nursing, a CU alum, and the co-president of the CU College of Nursing Alumni Association. For those of you joining us for the first time tonight, this series was developed in response to feedback from our alumni that you are looking for practical tips to support your self-care as health professionals. Tonight's topic is a look at how you can reduce stress with ways to practice mindfulness during this uncertain time. So I'd like to introduce tonight's guest speaker. Dr. Liz Chamberlain is a licensed psychologist at the CU Wellness Clinic at the CU Anschutz Health and Wellness Center and holds a clinical appointment as a senior instructor in the Department of Psychiatry. She earned her BA in English and Psychology at the University of Michigan in 1991. And after a short career in advertising and marketing research, she graduated with her PhD in counseling psychology from the University of North Texas in 2003. Dr. Chamberlain has worked in private practice, university counseling centers, community mental health and family therapy settings, has presented at national conferences, and has authored a book chapter on custodial grandparenting. She has focused her clinical work in mindfulness-based interventions and has integrated these evidence-supported therapies into her help with individuals, couples, and workshop participants to learn new ways to see blind spots, navigate change, and construct new narratives. Thank you, Dr. Chamberlain, for being our speaker this afternoon.
Thank you, Denise. And hello, everybody. Thank you for having me and inviting me to your Healthy Happy Hour. It's a really different format for me not to be able to see anybody in the audience, but I'll be interacting with you a little bit as we go. And today I'll talk a little bit about what we're going to go over, but I just wanted to start with this quote. I don't know if any of you know who Pema Chodron is, but she is one of the masters of mindfulness, if there are masters. And she says, compassion for others begins with kindness to ourselves. So that's part of what we're going to be focusing on today, is finding ways to care for yourself in the midst of caring for others. You all know who I am, so I will skip that slide. And before I ask this question, I just really wanted to take a moment just to acknowledge just how much suffering is around us right now, and it's shifting seemingly daily, weekly. The type of suffering has changed for so many of us, socially, racially, as well as individually, with patients that we see, with our families, and that we're all really suffering losses. It's just really collective grief and trauma for so many of us. And a lot of psychologists, like myself, are recognizing how much trauma this is creating, and looking at research that has shown trauma in past SARS cases, like in Toronto, how many healthcare workers experienced PTSD symptoms beyond that. And we're getting some data out of China and Italy showing some PTSD symptoms among healthcare providers as well. And I know that a lot of you have experienced difficulties with maybe some burnout, maybe some secondary trauma, maybe some primary trauma in the settings that you've worked in, even before any of this happens. So we're hoping, and I'm hoping, that I can give you just some short tools, brief tools that you can use in the moment, instead of maybe practicing meditation, which a lot of people don't have time to do, that can help you just get through some difficult times. So I have a question for all of you just to start with, and I'll invite you all to use the chat function. Some people find it really helpful to share, and in fact, that's part of self-compassion, is finding common humanity and knowing that we're not alone in what we're experiencing. So I'm going to invite you, if you feel comfortable, to use the chat function and have the message to not just all panelists, but below it to all attendees. And I'll ask you the question, thinking of the things that are stressors for you right now, what are your own personal stressors? And this could be stressors at work, this could be stressors at home. Since things are blended right now, this could be stressors, work and home combined. Maybe they're quarantine stress or maybe caregiving stress. And I'll share, mine right now as a psychologist. This is the first time that I've done telehealth, especially from my house. So I didn't really realize how difficult it would be to actually invite some of the suffering into my own home that I usually contain and can leave at the office. So that's been a real challenge for me, as well as trying to help my 13-year-old structure her day, and just juggling my partner's work and my work. So it's really been very difficult. And I'm seeing some of you sharing some things, and I'm grateful to see some of these things, which is the mingling also for some of you, worried about asymptomatic COVID, what that's going to be, some of the injustice going on, the political climate, and not really getting clear direction. So yes, thank you. So many uncertain things right now, and continue just to share some of those stressors, because we'll go back to those as we go along here, and perhaps some of the things that we're sharing in terms of working with stress will resonate when you think of these stressors. So I like to talk about what we are going to talk about in experience today in our session. So the first thing is we're going to look at what mindfulness is and what mindfulness self-compassion is, and define those. And then I'm going to talk a little bit about why mindfulness and how does it work? And of course, the biggest question is, well, do I really have to meditate? And I'll share a little bit about what research says about that and where research is going with that. And then the next piece is mindful self-compassion, which I like to think about as almost like a mindfulness 102 or maybe 200 level class. It takes mindfulness and goes another step, which is helping us be mindful about difficult feelings and our suffering. And then we'll do some practice. So you can really experience some mindfulness. And I like to say how practice makes present, if we can have some muscle memory with some of these practices. So we'll start with what mindfulness is and is not. And I usually ask people when I do these seminars or I do these workshops about when they think of mindfulness, what comes to mind. And a lot of people find it really hard to define, because we have this idea of, well, it means this relaxed state or this present state. And that is true. It is a very present state. It's very different from relaxation. And it's a really different way, which is the operational definition, to relate instead of reacting to our thoughts, sensations, and emotions as they arise. So I'm going to invite you all, because you're all scientists, you're all alumni of our wonderful university, to observe like a scientist when you have experiences, when you have thoughts, feelings, sensations, and we can actually describe those while experiencing them, instead of labeling them or having stories about them, which is what all of us do, because we've all had history and experiences with how we feel, how we think. So with mindfulness, the key is to try to approach and acknowledge whatever's happening in the moment, instead of pushing it away, avoiding it, or needing to fix it, which so many of us do. We're healers, we support others, we want to help people feel better. And a lot of us don't want to feel painful things, so we tend to push things away. When we feel stress, we're like, well, I just want to de-stress and get rid of whatever is bothering me. But with mindfulness, we train and we teach ourselves to instead approach and acknowledge difficult things and accept that experience. It doesn't mean that we always like the experience, but we accept it without having a story or a narrative that we put to it. And so then I think it's important also to share what mindfulness is not. And it's not trying to get the right thoughts. And that's going to be important as we look at self-compassion as well, because all of you wouldn't be here if you weren't high achievers, if you weren't ambitious and have goals that you set. And we strive for a lot of things. But mindfulness is not trying to do it right or do it the right way or practice meditations the right way. This is an ongoing process. So when I mentioned Pema Chodron earlier, and I said she was a master, I doubt that she would call herself a master, because the mindfulness practice is an ongoing practice. Mindfulness is also not being on autopilot or daydreaming about past or future events. In fact, it's quite the opposite. It's learning to notice when we do go on autopilot, like when we're driving, or when our mind starts to wander about our days, when we're getting ready, perhaps in the shower, brushing our teeth. Our mind is already, way ahead of us. But instead, it's being present in the moment and describing what's happening in that moment. And again, it's not shutting off thoughts or pushing away thoughts that we don't want or don't think we should have. And I'll talk about shoulds in a little bit with some mind traps when we talk more about stress. And again, it's an ongoing process. We're not trying to reach a goal. And it's also not letting your mind wander without purpose. I think a lot of times people think meditation can be just letting your mind wander, just trying to create some transcendental experience. And that is a form of meditation, to focus on a word. But we do more insight-oriented meditation and insight-oriented practice with mindfulness, which is having a purpose to observe without getting wrapped up in thoughts or getting pulled into a rabbit hole with some of the thoughts that we typically have. And finally, we're not judging our efforts with mindfulness practice as good or bad, or our feelings as good or bad, but instead just approaching them and just creating awareness around which practices work for you and which don't work for you. It's a very personal experience and a very personal journey when you begin to become aware of how to be more mindful. Meditation works for some people, it doesn't work for others. Intermittent sort of informal practice works for some people, not for others. It just really depends on how you are able to begin to notice and experience your feelings, thoughts, and sensations. So I like this graphic of thinking of mindfulness really being the container for our sensations, our thoughts, our emotions, that we can hold instead of immediately responding to them. And what's nice about it is when we begin to recognize how we react to things, and we notice that what reactions we have, we can even contain this reaction, can even go into the container. So it's a place to pause and hold these things before we respond to them without reacting in typical ways. I'm going to skip this or just go over it briefly. Informal practice is what we're going to talk about more today, and maybe do just some really brief formal practices, which is much more meditations. But the most important thing about informal practice are incorporating some attitudes of mindfulness into your everyday experiences. And there are actually 8 tenets of mindfulness that are incorporated into mindfulness-based stress reduction, which was created by Jon Kabat-Zinn, and I'll talk about him in a little bit. But the most important element is really this curiosity, this beginner's mind. If we can engage our scientist, curious mind and begin to approach things as if we haven't seen them before, and if we haven't experienced them before, that can be a really great place just to begin to be mindful. Noticing, walking outside, I'm noticing what the sky looks like just on this particular day, noticing what the clouds look like, describing them as wispy or full, looking at the colors of flowers out in our backyard. These can be ways just to be curious and as if you've never seen something before. And then the other one we'll talk about more is self-compassion and what that means. All right, so of course people ask, well, why should I practice mindfulness? Why should I even be interested in it? I have a short video that I'd like just to play. It's a 3-minute video, but I think it's pretty powerful because it's Jon Kabat-Zinn, who is the founder of mindfulness-based stress reduction, and he actually founded it as I think he was a PhD in physiology working at UMass General Hospital, and he was assigned to help cardiac patients lower their stress levels or perhaps work with some of their pain. And he was a practicing Buddhist, and so he incorporated some of the Buddhist practices and created this program, and they found these really surprising results of how it reduced blood pressure, reduced stress. It was during the time in the 70s when Herbert Benson was doing the relaxation response, a lot of biofeedback. Some of you may have done heart math, so there's some of those elements in that. But I'll let Jon Kabat-Zinn speak, as well as Richard Davis, who is at University of Wisconsin. And there are a couple of studies that just show how mindfulness can actually help us physically. So I'm going to play that for you.
Scientific research has always been the cornerstone of the work of the Stress Reduction Clinic and the Center for Mindfulness. It is through rigorous clinical and basic science research that MBSR and other mindfulness-based interventions have been shown to be effective and useful to people from all walks of life.
We would assess people before on various measures and then assess them afterwards. The research then went to a much higher level of randomized clinical trials to try to really discern in a much more stringent way what was going on with these people, say at the level of the biology, at the level of brain function, at the level of immune system.
We wouldn't be here 30 years later if it wasn't for the science, because you wouldn't have anything to talk about. You could just say, well, people think it's a good idea and they like it.
One of the first randomized trials to test the potential efficacy of mindfulness meditation was conducted in a study on psoriasis patients at UMass. While all the patients in the study were treated with the standard ultraviolet phototherapy, those in the experimental group were instructed to listen to guided mindfulness meditation tapes while undergoing treatment.
The group that was randomized to stress reduction were more successful in seeing the decrease in the psoriasis than the group that was not.
To tell you the truth, I didn't believe it. It was too phenomenal a result. For people who are meditating between 30 seconds and 10 minutes, three times a week for 4 months. They're not allowed to take tapes home and practice with them at home like in MBSR or anything like that. So it seems like, wow, this is affecting a healing process.
Another one was a study that we collaborated with Dr. Richard Davidson and his colleagues at the University of Wisconsin in Madison, and that was on a worksite study where we randomized a workforce into an experimental group who took the 8-week MBSR program and a control group who did not take it.
We actually did it with not the traditional MBSR clientele, but rather with a group of highly stressed employees at a high-tech corporation in Madison. The study demonstrated that MBSR, compared to a control condition, did indeed change brain function in specific ways over the course of 8 weeks.
We tested them with a flu vaccine and measured their antibody responses over the course of many weeks following the course.
And what we found is that the participants in the MBSR group showed a significant boost in their response to the vaccine compared to the control group. And the amount that their brain changed actually predicted how much the vaccine was effective. So this was really a landmark study in many ways, and really, I think, the beginning of the era of modern research on meditation.
All right, so to me,
Scientific research.
That's pretty powerful, especially the antibody research that they found. And there are literally tens of thousands of papers now and journal publications about mindfulness and about different interventions across all sorts of different difficulties and disorders. But to me, I mean, even in our day and age now, I think it's really important to know about stress and how it can affect our immune system, and knowing that practicing mindfulness with meditation is how this was measured, but even doing some of these other informal meditation practices or informal mindfulness practices, as we get more research into the informal pieces instead of a formalized program, we're seeing that we can really make some changes physiologically as well as in our brains. And I think this piece is really important too, about, well, how does mindfulness work in terms of our thought process, in terms of our stress? So one of the things that all of us do is have a lot of negative thoughts, and there actually is a name for it, and it's called the default mode network. And there's research that does looking at functional MRIs that shows parts of our brain, I think it's the posterior cingulate cortex, that actually is bigger and then shrinks when we do more meditation. And we think that's where this negative loop that we tend to go to without any other information or data. And maybe some of you have experienced that, you know, thinking about sometimes you get in loops, or you go over things again and again, and they tend to be negative. So I like this quote that Anne Lamott has, that my mind is a bad neighborhood I try not to go into alone. I think a lot of us can feel that way at times. So Rick Hansen talks about this concept, and I'll have his reference at the end of the presentation as well. But he talks about this negativity bias that's been developed for years. He even thinks about how it came up when we were living in caves and out on plains, and how we would look for threats in the environment to keep us alive. So we were primed to look for negative things so that we could survive another day. Unfortunately, saber-toothed tigers don't exist anymore, but stressors that exist in our daily lives are still pretty impactful and pretty big, and we tend to have this negativity bias, and during which this negative experiences are like Velcro, they stick, and the positive experiences bounce off like Teflon. So that's just something to be aware of as we go along here and talk more about our thoughts. And again, why our minds wander. When we're left alone with our thoughts, this is helpful. It's very self-protective for us to think about ourselves in terms of how others might see us, to do self-referential thinking. It protects us from danger and helps us not become too overwhelmed a lot of times if we're in certain situations or are having certain emotions. I'm not going to go through all of these slides because I'm just going to leave them if you would like to look at them on your own. The most important thing is that some of these studies have shown that more experienced mindfulness practitioners have that reduced default mode network activity. So it suggests that the more mindfulness practice we do, we get less caught up in that wandering mind, and we're able to observe it without getting pulled into it. So I'm going to skip through these. You may look at them later. We'll have this presentation up. But I think it's more important to talk about how mindfulness can help us with stress and negativity. And maybe just take a moment. I see a lot of you have listed many stressors that you're experiencing right now. Financial worries, people who are ill that you're caring for, a lot of other sadness and loss and grief that might be part of COVID, might be happening separately from COVID, trying to balance being a parent, working from home, trying to juggle all of that. So how does mindfulness reduce stress and negativity? When you just take a moment and just imagine those stressors again, just bring them to mind, and just be aware of where in your body you're feeling some of that stress. Is it in your stomach? Is it in your shoulders, in your chest? Some people feel tightness in their chest. Some people get a lot of tension in their shoulders. Some people get tension in their head or their faces. But just be aware of that. And so maybe just take a moment and just notice where that is. And maybe just ask it to soften for a minute. Just noticing your breath for a moment. And just having the awareness sometimes if that's the place where your stress begins. And once you can recognize where your stress begins, then you can begin to become more aware of it, and then become aware of the thoughts that might go along with it. And I'm sure a lot of you know about the fight, flight, or freeze sympathetic nervous system and the parasympathetic nervous system. So we all have these neurochemical reactions that just happen when we see a stressor or feel a stressor. And that fight or flight, spring to action, is really helpful. But sometimes if we have too much of it, it can actually get in the way of our functioning. It can affect our sleep. It can affect our eating. It can affect a lot of things in our lives, and sometimes even our health. The parasympathetic is our rest and digest, and that's actually what helps us activate more of this mindful response. And sometimes you can even activate it just by doing some deep belly breathing, even noticing the exhale and slowing that down. I've given you some apps at the end of this presentation that can help you practice that if that's something you'd like to explore. So the problem is that our brains don't distinguish between physiological or physical danger and psychological danger. And a lot of us are experiencing psychological danger. Some of us are experiencing both. There's a lot of injustice going on right now, and a lot of situations in which people are fearful for their lives in many different arenas. And this chronic exposure to stress, really, our bucket keeps filling. It can eventually overflow and spill out into a lot of other things. So here's how mindfulness actually helps this whole stress cycle and this stress response. It's really a continuous loop. So I have this huge bear, and if we have this big stressor, we get that fight or flight response, we have a reaction. There are often very negative thoughts and feelings that come up with this fight or flight response. And then we have a reaction with increased stress. And then guess what? The stress loop gets bigger and bigger. This bear gets bigger and bigger. With mindfulness, what we're doing is instead we're pausing. So we notice the stressor, we notice this fight or flight response, we notice where in our bodies we're feeling stress. Then we can pause. We can do some things to soothe it, and we can observe our thoughts and feelings. Instead of saying this thought must be the truth, we can notice the thought that we're having. We can begin to acknowledge that it might not be the truth, that it might be influenced by this fight or flight response. And once we can pause and begin to explore if that thought is entirely true, excuse me, we can then respond, and we can reduce our stress and increase resilience, which makes the upcoming stressors smaller. So with that ongoing practice, that's really how mindfulness can influence stressors. So this is a nice quote by Viktor Frankl. I'm sure a lot of you know who Viktor Frankl is. If some of you who don't, he was a Holocaust survivor. And in that horrible situation, he was able to notice that he had choices, and his freedom was really between stimulus and response. In that space is the power to choose how we respond, and when we choose and how we respond, that's where our growth and our freedom lies, and that's really what mindfulness is about. So we do get unhelpful thoughts, and they're mind traps. And so a lot of times we think that the event is what leads to how we're feeling. And again, those are those stories that we have, but really it's not the event that's leading to those feelings. It's the thoughts that are between the event and the feeling. And when we begin to notice them, we can then get curious about them, and then we can identify the mind traps. And mind traps are really fun. Some people call them thinking errors, distortions. This is from strict cognitive behavioral therapy, but in mindfulness-based cognitive therapy and mindfulness-based stress reduction, we also look at these so that we can start to recognize these mind traps that all of us have. I mean, even thinking about some stressors, like when we're driving and we're in traffic and we get really, I don't know if you guys get really angry and tense, but sometimes I do. Haven't been driving as much lately as we've been isolated more at home, but all of us engage in just some thoughts that are not so helpful. So with this tension, beginning to notice what some of the thoughts are, like I'm never going to get to work, or if I'm late, I'm going to get fired, then I'll be homeless and I'll be out on the street. And that can really be a catastrophic thought. So when we can recognize a thought as a trap and notice that it's really not 100% true, we can then begin to expand how we see a situation, and it can decrease then our fear, our anger, and our fear and sadness and worry, which are typically some of those very basic emotions that drive a lot of our stress and a lot of our thinking, because something's important to us. It's something we don't want to lose. And it's difficult, I think, now because there's so much suffering and there's so much difficulty that a lot of these are not mind traps. There are real dangers right now in our lives, but perhaps there's some that we can see some more balanced thoughts about, like, this is really difficult. Maybe there are some silver linings. Maybe having more time with your family, maybe having less commuting time has opened up some different things for you. Maybe being able to spend different time with your family, or maybe there are some other opportunities that have come up from working at home. So these are some things that you can sort through and maybe look at the stressors and look at stressful situations and begin to notice some of these mind traps. One of my favorites are the shoulds and the musts. And I always like to share this because the shoulds and the musts, there are some phrases that I think are really helpful to remember mind traps that were created by Albert Ellis, an old psychologist in the 60s who created rational emotive therapy. And he would say to people, when they would say things like, I should be able to get through this, I should be able to not feel upset, I should be able to do everything I want to do in a day and have the energy to go home and work out and get these projects done and publish my great paper. Those shoulds are really difficult. So Albert Ellis would say, are you shoulding on yourself? So I think that's a really nice phrase to help you sort of remember and trigger if the shoulds are getting in the way. And there are musts as well, such as everybody must like me. I must do 100% at my job every day. And these really get us into a lot of trouble because they're just not realistic. No one can do this. So the must, he would call masturbation, which again, these are really fun words that can help you see if you're engaging in some mind traps. And this is a nice just idea of thoughts not being facts, because we often think that they are, but thoughts, just like feelings, sensations, are events. So the psychologist Susan David has a nice phrase that she likes to put in front of any thought that occurs by saying, I'm having the thought that. It gives you some distance, and then you can really say, is this true? Well, it may be true, but is it 100% true? And then you can notice what that thought is like, how you feel, and you can begin expanding and exploring if there are some mind traps at play. You can begin naming the feelings, naming the thoughts, and just becoming more aware of them, inviting them instead of pushing them away when they are distressing. So this is one way to really examine the thoughts and begin to expand the possibilities and get curious about them. All right, so this next piece, once we know what mindfulness is, now I'd like to talk a little bit more about mindful self-compassion, which was developed by Kristin Neff. Some of you may have heard of Kristin Neff. She's a psychologist who did her postdoc work at Stanford, and she also was a practicing Buddhist. But in her developmental psychology postdoc, she wanted to study self-esteem. And what she discovered, because she was going through some difficult times as well, what she discovered was self-esteem really wasn't helping her when she was in crisis and when she was really going through difficult times. That you know, asking, and you might even ask yourselves, if I asked all of you to raise your hand if you thought you were average, I don't think any of you would raise your hand. None of us think that we are. And with self-esteem, there's a lot of just comparison and striving to be the best. When we're suffering, that really doesn't work so well. So instead of trying to tell ourselves that we're the best and we're great at what we do, with mindful self-compassion instead, we are noticing that we are flawed humans and that we suffer, and that's what really connects us to everyone. So mindful self-compassion is a next step to mindfulness. So I'm going to encourage you all again to just go into your chat box, and perhaps if you'd like to share, it'd be really helpful if you'd like to share with all panelists and all attendees, because we think about self-compassion, and a lot of us have ideas about what it means to be compassionate to ourselves versus being hard on ourselves. So I don't know, the first question I would ask you all is, what are the fears? What would happen? What might happen if you're compassionate to yourself? What are some of the possible downsides of being kind and compassionate to yourself? What worries would others around you have? People that you work with, maybe your families. Oh, here's a good one. What if people don't like me if I'm really kind to myself? And I don't know if some of you may have taken the self-compassion scale that Megan sent out on Monday. I don't know if anybody wants to raise their hand if they've taken it and if they got some scores from it. Oh, there's one. Great. Oh, awesome. Great. Oh, great. This is really good. You all are sharing some of the things that others might consider me weak. You may not achieve as much. You might get lazy. I would seem selfish and self-centered. Yes, not following through. This is exactly it. This is exactly why a lot of us aren't compassionate toward ourselves. And a lot of you who took the self-compassion inventory, I'm wondering if you looked at your scores. And a lot of us, getting a 3 is the average score across the subscales as well as the overall scale. And it's okay if you're under 3, because a lot of us are, especially in our profession, in a helping profession. We put a lot of pressure on ourselves to be healers, to help others. And we think that if we don't, that there's something wrong with us. But if we don't push ourselves, and if we don't use this critical voice, we often think that we're not going to achieve, and that we're not going to perform at the level that others expect of us. Yes, you all really get this. I can see that you all have a lot of the thoughts that we all have about what it means to invoke self-compassion. But the good news is we can shift some of the scores in self-compassion by practicing it. And self-compassion is inherent in mindfulness, but it's not explicitly practiced. So we're going to try a little bit of self-compassion just to start with. And self-compassion essentially is treating yourself as you would treat a friend or a loved one. And again, it's not self-esteem, which is like Stuart Smalley here saying we're good enough and smart enough. I know I'm probably showing my age with some old Saturday Night Live sketches here. If any of you haven't seen Stuart Smalley, it's very funny. It's Al Franken, who unfortunately has not not been the best citizen in a lot of ways. He was not very helpful with the Me Too movement, unfortunately. But he was a funny comedian, and Stuart Smalley is a funny character. So we're not trying to give affirmations of being good enough, smart enough, having self-esteem. Again, we are trying to notice our sense of suffering. So I'd like you all just to take a moment and just think about various times, maybe even closing your eyes, just to reflect on times when you've had a close friend who was struggling in some way, suffering with some problem, had a misfortune, failed, felt inadequate, and you were in an okay place. You were able to support this friend. Now, what would you say to your friend, or what do you typically say to your friends in these situations? You know, what tone of voice do you use? What's your posture or your nonverbal gestures? Just take a moment and think about what you would say to those friends. And if you want to jot them down and share them, you're welcome to. And now close your eyes again and reflect on this next question. Thinking about times in your life when you were struggling in some way. You had a misfortune, you failed, or you felt inadequate. Now, what do you say to yourself? How do you typically respond to yourself in these situations? What do you say? What tone do you use? What's your posture or nonverbal gesture to yourself? Just take a moment and notice those differences. Oh, I like this. Somebody said you can't be perfect all the time. You're human, right? And our friends, we say, it's okay, it'll be fine. Now imagine, if a friend came to you and said, I'm never going to find somebody, I'm going to be single for the rest of my life. And we were to say to them, yeah, you know what? You're just a terrible person. I don't think you're going to find anybody either. Yeah, I think you better just go to spinster school. I mean, these are huge exaggerations, but we wouldn't be friends with somebody very long if they said those things to us. But the things we say to ourselves, the harsh criticism, we would never, ever say those to friends in our lives. So we all do this, and we all have a lot of self-criticism. And a lot of us think that if we're self-critical, it motivates us to do better. But Kristin, Neff, and others' research actually shows that's not the case, that when we are able to be more compassionate with ourselves, we actually do succeed more. So again, this is explicitly teaching some of these skills is what we do in self-compassion work. And I like this explanation of it because I think it's so important, especially for caregivers. So with mindfulness, we just accept experience and notice it as it is, all equal, all feelings, just holding them equally. With mindful self-compassion, instead of accepting the experience, we actually care for the experiencer. And in this case, it's ourselves and extending care to ourselves. So in mindfulness, we ask the question, what am I experiencing right now? But a more helpful question with mindful self-compassion is, what do I need right now? And again, feeling your suffering with spacious awareness, it's great, it's very cerebral. But with mindful self-compassion, we notice what we're suffering, and then we extend kindness to ourselves when we suffer. So it really helps us in difficult times. And there are three components of self-compassion, which are the self-kindness, common humanity, and mindfulness. And I'm going to do a brief exercise with you so you can experience what each of those are in a self-compassion practice. And self-kindness essentially is our antidote to self-criticism. So what you just experienced with what you would say to a friend and what you would say to yourself, that's really how we begin to shift ourselves out of self-criticism, by using self-kindness and practicing some self-kindness, which is not easy because we're very used to being hard on ourselves. And the common humanity, which is what a lot of us are going through right now, and I think is one of the really key pieces in surviving what we're going through, which is saying, I'm suffering just like others are suffering. This is what it feels like to feel isolated. This is what it feels like to experience trauma. This is what it feels like to experience suffering, to witness suffering. And that's what others are going through right now as well. This is what it feels like to worry about stability, about financial concerns, about health. So that's the antidote to suffering, is knowing that we are connected in that suffering. And then finally, the mindfulness is the antidote to the reactivity, being aware and pausing before we respond. So we're really just trying to look at negative thoughts and feelings, things that are more difficult, with self-compassion, which I think is really a lot more important than very basic mindfulness, which is, I think, cannot be as helpful without this extra step. Oops, I went backwards. Okay, so you already noticed what gets in the way of self-compassion. So you've already shared a lot of these. It's going to make me weak. It's being self-indulgent. It's making excuses for my bad behavior. And self-criticism really helps motivate me. These are all thoughts that all of us have. So Kristin, Neff, and others have used these criteria and have examined the components of self-compassion in a number of different studies. And if you want to look at those, I would encourage you to look at Kristin Neff's website that I have at the end of the presentation, which has links to specific peer-reviewed articles that show how these conclusions, how she's come to these conclusions, and how others have come to these conclusions, that there actually is evidence that when we practice self-compassion, we do much better and are much kinder to ourselves. I'm going to skip these because I think I would rather just have you do some experiences with self-compassion than going through the rest of these slides, and then we'll leave another just 10 minutes for questions at the end. So this is really an important piece to remember, though, is what you resist, what you try to push away, not only persists, but grows in size. So welcoming some of this difficulty, welcoming some of these experiences can be really helpful. I'm going to skip through these again, but there is some research that shows that self-compassion is especially helpful for caregivers with specific stress, burnout, and the components that contribute to that. I know that a couple of weeks ago, you all, if you attended the burnout presentation, you learned much more about what contributes to burnout and the research on that. So this is a way to actually help yourselves be more resilient, and when you're feeling burned out or beginning to feel some burnout, how you can have the emotional resources needed to care for others. There's a study, again, you can look at Kristin Neff's website, but this just showed a group of nurses and how their scores really increased in terms of resilience, burnout, secondary traumatic stress, and actually, increased to be closer to the general population once they completed an 8-week mindful self-compassion course. So ready to practice. So I'm going to invite you all just to be comfortable where you're sitting, and just to begin noticing the chair wherever you are, noticing your feet on the ground, noticing your back being supported, almost as if there's a string pulling up your head, and just becoming aware of your breath without changing it, without altering it. Just taking a few moments to be still, and just congratulating yourself for taking this time for this practice. And just begin to check in, just feeling into your body and mind, and simply allowing any waves of thought, emotion, or physical sensation to just be. Maybe this is the first break you've had in a busy day. And as you begin to enter the world of being rather than doing, you may notice a trajectory of feelings that you've been carrying within yourself. There's no need to judge, analyze, or figure things out. Just allow yourself to be in the here and now, amidst everything that is present in this moment. Just spend another minute just checking in with yourself in this way. Just riding the waves of your breath, noticing where there might be tension, and asking it to release. And just bringing yourself back when you're ready and opening your eyes and just being in a space to practice some self-compassion. So now that we've gotten more in touch with our body and hopefully decreased some of that stress response and activated our parasympathetic system a little bit more, this first informal practice is called soothing touch. And this is something that you can practice anytime. And this is just finding a way to find a sensation that feels comforting to you. And it's going to be different for anybody. It's useful to harness compassion. It can actually trigger a compassion response by having this physical touch. So just again, finding that space and perhaps closing your eyes. I'm going to read a list of different ways, things for you to try, and it's nice that we don't have to be around each other sometimes in this practice. But just take a moment and try placing one hand over your heart and just notice how that feels. And noticing what touch feels safe and comforting for you. Try 2 hands over your heart. See if that pressure makes a difference. Try gently stroking your chest. Making a fist with one hand and cupping it with the other, so that's a little more pressure on your heart. Just play with that a little bit. Try releasing that fist and putting one hand on your heart. Trying one hand on your belly. Expanding the belly with an inhale and slowly exhaling. Just noticing how that feels for you. Try placing 2 hands on your belly. Noticing if that feels comforting. For some, face touches feel better. For some, they don't. Try one hand on your cheek. Try cradling your hands, your face in your hands. Try gently stroking your arms. Maybe giving yourself a nice, gentle hug. Try one hand tenderly holding the other. And then try cupping your hands in your lap. And just taking a minute to try just anything else that feels soothing and comforting. There may be touches that you remember from family members that felt good for you. If anything uncomfortable comes up, please shift to something else. This is really different for all of us. So once you've found something that feels comforting to you, this is something you can use anytime when you're in a difficult moment, when you're transitioning from maybe one caring room to another and you've had a difficult patient or difficult time. And now this is a way to take a break, a self-compassion break using this touch. So just think of a situation in your life that's causing you some stress. Could be a health issue, a relationship issue, work, some other struggle. And choosing something maybe in the moderate range, not something really huge right now. We can always work up to that. And just visualize that situation clearly in your mind's eye. Just close your eyes for a moment and imagine what the setting is, who is saying what to whom, what's happening, and think about what might happen in that situation. And notice the discomfort that you feel in your body, much like we practiced before with stressors. Where do you feel it? Just begin to pay attention to where that feeling is, where the discomfort is. And now saying to yourself, this is a moment of suffering. That's the mindfulness part of those 3 elements. Maybe other wording might speak to you better, like this hurts, ouch, this is stressful, this is really difficult. And now try saying to yourself, suffering is a part of life. That's common humanity. Other things you might say would be, I'm not alone. Everyone experiences this just like me. This is how it feels when others struggle in this way. And now offer yourself that gesture of soothing touch. For me, I like putting my hand over my heart. And try saying to yourself, may I be kind to myself? Or may I give myself what I need? Maybe some other words may resonate, like, may I accept myself and how I feel in this moment? May I accept myself as I am? May I begin to accept myself as I am? May I be strong? May I be patient? And if it's hard to find the right words, again, imagine what you would say to a friend or a loved one if they were struggling with the same situation. What simple message would you deliver to your friend heart to heart? Just imagine that. And now see if you can offer that same message to yourself. So that's something simple that you can do in a difficult moment. There are other longer, for very difficult situations in caregiving stress that I have on some videos, as well as Kristin Neff has a longer video for compassion for caregivers and having compassion with equanimity. And a lot of times, you know, we think we have compassion fatigue, but we really have empathy fatigue. When we put ourselves in somebody's shoes and try to experience what they're experiencing, that can lead to more burnout. When we're able to practice compassion for ourselves, which is holding our own suffering, we can then begin to hold others' suffering without becoming so pulled in by what they're experiencing. But we can extend that same compassion by breathing in compassion for ourselves and breathing out compassion for another, especially when things don't go the way that we'd like them to go. And that happens to a lot of us. And even when we have a difficult situation and we have to transition into maybe a different caring room, maybe a different room in our house, maybe that's one thing that's been really difficult for me too, is making the transition from work to home in my home. But Elisha Goldstein, who's another psychologist, who's a great mindfulness practitioner, whose reference I have at the end of this presentation, talks about a doorknob meditation. I think it's really a great way to use a doorknob or a handle as a cue to pause, close your eyes, invoke some of the practices that we've done to notice where there's tension in your body, take a breath, notice where you are, ask any tension to release, and have intention before you walk into a room of being compassionate, holding your own suffering, and being open to, you know, what you walk into. So that can also be really helpful. Well, I didn't get to do as many of the practices as I thought we might, but the good news is I do have some references where you can practice them on your own if you'd like. We also have some videos that I've done through our center that I have a link for as well. And I'd like to invite you all, since we have a few minutes left, if you have some questions, to please put those in the Q&A box and I can answer any questions that you might have. I'm just going to click through these quickly. There are some other really basic practices. Sometimes using an object, there's a here and now stone exercise that can be really helpful to absorb yourself in noticing what the stone looks like, what it feels like. That can help you get out of that default mode network. Even just being in your body, noticing soles of the feet, standing, rocking back and forth a little bit. These are all things you can do in the moment if you're in a caregiving situation or any situation where you don't really have to meditate. So again, these are just some more things with caregiving fatigue that I would encourage you to explore, and just having some compassionate phrases for yourself when things are difficult, to actually acknowledge the difficulty and say, this is stressful, I'm feeling overwhelmed. Again, we can become really self-critical when we think we're not doing enough or giving enough and become really emotionally depleted. Sometimes it's being able to say phrases such as, you know, I can't, this person is on their own journey and I can't fix this or make it better even though I wish I could. We can do as much as we can, and we're human. There are limits to what we can do. So I would encourage you to try that. I'm going to just click through this. Just some practice making present. And I just like this quote: the best way out is always through. When we try to push things away or try to de-stress, it doesn't work so well. When we think of ourselves as a guest house and have all the feelings come in instead of trying to keep some away, because when we try to keep anger or fear, we try to keep them out. We don't want to sit with them. We don't want them coming into our guest house. They get bigger and bigger and they end up crashing through the door when we don't really know how to handle them, and then we don't know how to get rid of them, and they can overwhelm us. But if we invite them in when they appear and have them sit with us and make friends with them, we can typically deal with them a little bit better if we invite them instead of trying to push them aside. And this is just being a compassionate mess, which means not striving to be perfect or being the most compassionate person or the most compassionate you can be, but asking this question, even if you can't answer it: what do I need right now? You can usually allow yourself just that moment of self-compassion. It's really just a nice question when you are suffering, just to say, what do I need right now, to check in that way. That can be really helpful. Okay, let's see if there's anything else. And I have just these apps and videos for you to look into. I think that Insight Timer was something mentioned in the burnout presentation. I love Insight Timer because it's free and you can search certain teachers. So there are these 4 that I like very much. They're all psychologists. Worry Time is a great app if you can't sleep or wake up during the night, because the default mode network is really active when you have that quiet time. Scheduling worry time can be helpful. Breathe by Dr. Judd is that knowing how to expand that exhale. And Stop, Breathe, and Think is great. It's really developed for kids, but I think it's a nice way to learn how to do some very basic meditation practices too. And then we just have some other resources on our website through the Health and Wellness Center. And just some more books for you, just some more websites that you might find useful. A lot of these, this is a great workbook. I really enjoy the Mindful Self-Compassion workbook. I like a lot of Kristin Neff's work. For some of you that might not resonate, the Mindfulness Stress Reduction workbook is much more mindfulness, like talked about in the beginning. And then I like Rick Hanson's, this is his newest book, Neurodharma. His other book, Buddha's Brain, talks more about that default mode network and the Velcro. And he has a lot of other information on his website, including a lot of resources with research. And of course, any questions that you might have. I don't know if we have any Q&A. There's one. Let me see what we have here. Oh, these practices apply to trauma and PTSD. Yes, that's actually a great question. There are a couple things with trauma and that are helpful. One of them is grounding, which again is engaging your senses. Sometimes people use that stone. Whenever I've worked with people who have been in situations and have needed just to ground themselves, sometimes sand really helps. But anything that engages your senses, you could even run cold or warm water intermittently on your hands. That can help ground you in a moment. When you're showering in the morning or at night, if you just notice what the temperature feels like, noticing what the soap smells like, that can help ground you quite a bit. There are many everyday activities that you can try that will help in those situations. It's very easy with any kind of trauma that we get that hyper-vigilant, we get that reactive response. There are many therapies that are helpful if you have experienced trauma. I'm not an EMDR practitioner. Some people do like EMDR. One way you can practice that on your own is simply by walking, getting that bilateral stimulation and going over something that's an experience that's been traumatic, so that it begins to get reintegrated into your body. I work with more narrative, expressive treatments for trauma, being able to sort through something and create different meaning and integrate it differently. So I will. And again, I have my email if any of you want to email me. I'm a practitioner at the clinic. I take all insurance at our wellness clinic, and our information is on our website if you'd like to schedule something with me or if you have any questions. And I think we are toward the end. Are there any other questions that we have? Denise, do you see anything else?
I don't see so. I see some well done and some good work.
Thank you. So I'll give you all permission. Here's your permission slip. I'm giving you all a prescription that you have permission to practice self-compassion. Sometimes we need that permission. So I'll click through, and then Denise, I'll hand it back to you to talk about what's coming up. So thank you all for being here, and I wish you all well. I wish you all health and lots of compassion.
I think it was a very timely message, and we really needed to hear it. So thank you, Dr. Liz Chamberlain, for your time and sharing your helpful tips and your expertise with our group. And to all of our attendees, we hope you'll join us for our next series on June 24th. We'll have endocrinologist and director of the Anschutz Health and Wellness Center, Dr. Daniel Seson, and he'll speak on the role of sleep in your health and immunity. Another good one. So thank you, everyone, for joining us, and thank you for all you do as healthcare professionals for your campus and your community. And we hope to see you in a few weeks.